Hey everyone, I hope you guys are all doing well. Wanted to make a quick video for all my patients um, about this whole COVID-19 that's spreading throughout the country. Initially it looked like it was spreading pretty slowly. That spread is gaining momentum pretty quickly, and so we want to make sure that we keep everyone safe. Um, and we follow proper protocols and how we determine who should and should not receive dental care over the next few weeks. We are going to be making some changes. Not every dental procedure is going to be done, and we will be selective on which patients will be allowed to come in for the meantime. As this changes day to day. Our protocols could change too. We may come to a point where we're at a complete shutdown. Hopefully, that doesn't happen, and we can continue to see emergency patients. But currently, we've developed a protocol, and this is our protocol in place right now. So, just a couple things, just so you understand. When you come into the office and things are different, and we ask you to do some different things, it is. We don't want anyone to feel bothered or offended, but this is what we feel needs to be done in order to keep everyone safe. So, the first thing is if you are coming in for an approved dental appointment, we ask that you not bring family members into the lobby. Family members will not be allowed to wait in the lobby. They can either stay in the car or at home. If you're a parent and your child has a dental emergency and needs to come in, then you can go in the room with your child, but we are trying to reduce the number of contacts that you have with other people. When you come to the office, you will be asked to immediately wash your hands for 30 seconds. As you leave the office, you will again be asked to wash your hands. While you're there and before any work is done, we will also have you rinse your mouth with mouthwash, just in case you are an asymptomatic individual and you are shedding some virus. We are hoping that this will help to decrease the viral load. If you are a symptomatic individual and that you have a fever, we ask that your appointments be postponed at least 72 hours after the fever has broke. All of these protocols are in place so that we can keep you safe and keep us safe. I need to keep my staff members safe. We have had it, we have talked extensively in our office on how to handle this going forward. We have staff members who want to work but are also cautious of the situation, and we all need to be mindful of that. My staff members are not required to come to work right now. So, that being said, there may be some disruption in the schedule. We may have to reschedule things that are on the schedule. There are also going to be certain procedures that we may feel are not necessary to do right now, that are not critical, and we may postpone your appointment for, a few weeks out, 3, maybe 4, depending on how long this goes. Hopefully we don't have to go longer than that, but it could be even, 5, 6 weeks before we get you in, to do a simple filling or something like that. We want our main focus to be on more urgent procedures that need to be done now in a timely manner. And we will put less focus on procedures that are not absolutely necessary right now. as I said, things can change. We are receiving recommendations from both the ADA and the state dental board. We will continue to follow those closely and may adjust our schedule based on, if different recommendations come down. If you have questions, feel free to call the office. Currently, we plan on having someone there to answer phones, even if we are not there to treat patients during our normal hours. As always, we won't be there on the weekend. But if you look at our normal hours, we should have someone there answering the phone. If we have a dental emergency, we can address that. Many of the procedures that are scheduled are safe. We are working very hard to make sure that the office is clean and disinfected. We disinfect each operatory after each patient. We always do this. We have gone through the office today and essentially deep cleaned the office and sterilized every nook and cranny just to make sure there's nothing there. And we know that there aren't a lot of cases in Oklahoma right now, so chances of anyone having come in the last week that had this new virus is likely zero, but we are taking every precaution to keep it that way. We will be sending an email out with these things outlined, but I wanted to make this video so that you could reference back, and just because I think most of my patients know that I'm a pretty personable guy, and I like to talk with you on face-to-face level. And unfortunately, right now we can't always do that. We're not supposed to be too close to each other. But I wish you all safety. Again, we will talk with each of you individually that are on the schedule about whether we feel it is appropriate to keep you on the schedule or to postpone treatment. Keeping in mind that those things could change any day and could change day to day. And we'll watch those closely and see how things progress and put a focus on your health and our health so that, once this passes, we are ready to go and continue providing you the care that you need and deserve. If you have any questions, feel free to call us 405-701-2922, or you can email us at bramerdental@gmail.com. Hope you guys have a safe next couple of weeks, and let us know if there's anything that we can do to help you out. All right, talk to you later.